I'm going to talk to Calum Semple about the impact of the COVID-19 pandemic on people with cystic fibrosis and the implications of the new vaccines that have become available. Professor Semple runs a team who have undertaken a very important, very large study, which has given us a lot of information around the COVID-19 disease, how it presents, and the risk factors. And he also sits on SAGE, which is a committee that gives the government advice and direction with regard to how to handle the pandemic. So our advice changed for the second wave, Callum, in that we advised adults with CF to try and work at home if possible, or avoid contacts if possible, but we advise younger children to go back to school, and that appears to have gone well. And obviously, whenever you're considering younger children, the importance of going to school is enormous, and we appreciated that. So, but having said that, we still remain in a situation where we want people with CF not to be impacted by this virus. And one of the interesting things that you were telling me about last week was your work looking at co-infection between COVID-19, between the coronavirus and flu, which came as a surprise to me.
This is another surprise to us as well, and actually it's quite a worry. I don't want to panic people, but it is a worry. So people do animal experiments. They're very important for understanding how viruses essentially hurt people. And in experiments when they've looked at giving coronavirus to animals, the animals on the whole handle the virus quite well. And if you give them influenza, likewise, they handle the virus quite well. But if you give the animals the two viruses, if you give them coronavirus first and then flu, or flu and then coronavirus, the animals do extremely badly. A lot of them literally curl up and die. This is a very worrying signal that there's an interplay between the two viruses. And then when we look at the human data, we didn't have much flu going around in the summer, but we did just at the start of this. And those people that had flu plus coronavirus in March had hospital stays that were 2.5 times longer than the hospital stay if they just had coronavirus on its own. So this is a warning sign that influenza vaccination probably is the most important thing to sort yourself out with coming into this winter. And if you've got cystic fibrosis or any other medical condition, then I would say focus on influenza, because we know that does hurt you if you've got cystic fibrosis and other conditions. And it might just be that coronavirus plus flu would make your influenza much worse.
I mean, most people with cystic fibrosis will, and a large amount of their families will have been vaccinated against flu in this season, because we strongly encourage that. But if they haven't, yeah, that's a good message. That's a priority at the moment. And then we have these vaccines against coronavirus emerging, and that's been very exciting. And to be honest, it's taken me by surprise. Well, one, how quickly they've come through, and secondly, how effective they've been. And I guess that kind of reflects some of the innovative approaches that are being taken by the companies to generate the immunization, the immune response.
We've got 3 very exciting vaccines coming forward at the moment. The Pfizer-BioNTech vaccine has received MHRA approval. That means that an independent group have looked at the data, the safety data, and the effectiveness data, and decided it's suitable to give to people in Britain over the age of 16. There's another vaccine called, it's nearly identical to the Pfizer-BioNTech vaccine, and there's a third coming out of Oxford called Chadox, or sometimes called the Oxford AstraZeneca vaccine. What's exciting to me as a scientist, first of all, they're going to save lives, but it's a very new technology compared to the 200-year-old technology that we've been using for other vaccines. So there's essentially three generations of vaccines. We've got the vaccines that came from the days of smallpox, and which really haven't changed that much, even up to the dates of the MMR, where we give people a live virus which had its So it's a live virus, but a gentle form. It gives you a miniature version of the disease, and that protects you from the major version of the disease. So that's generation 1. Generation 2 is the protein vaccine, such as the pneumococcal vaccine that lots of you will have had. And that's where they inject just a protein and you make antibodies to that. This new type is called an RNA vaccine. And it's the equivalent of sending your body an email and telling the immune system to get on and make a vaccine to the message inside the email. So quite incredibly, there is no virus involved in this vaccine at all. And it's simply a little bit of code and instruction set of how to make the protein, and the immune system recognizes that code, and the protein that's made recognizes that protein and makes the antibodies to it. So because you're not being given a virus, you can't get sick to it. If you do get a slight sweat and flu-like feeling, that's your immune system reacting and generating your own immunity, and that's very, very important. And so far, these vaccines have had 95% effectiveness, which is amazing.
Remarkable, yeah.
I mean, the importance of 95% effectiveness means that you don't need to rely on herd immunity, because if you give the vaccine to someone that's susceptible, 95 times out of 100 you're protecting them. The older generations of vaccine, generations 1 and generations 2, relied on vaccinating the whole point, that 50 to 70% were covered, and then the virus couldn't spread throughout the community, and that protected people. This third generation vaccine, these protect the actual people themselves, which is, again, is remarkable.
And some of the anxieties that have been generated and to some degree fueled by social media have been unfortunate, but one of the anxieties has been how quickly these vaccines have emerged. To me, that's fantastic. That's a really good news story, but can you understand that sort of anxiety? Or
I can understand it, and we've got to appreciate, people hear this and they think this is new and it's worrying, and sending emails is this genetic manipulation, and it's not genetic. For starters, it's not genetic information. The genes of your body are not being changed. It's the RNA code that makes the protein at the end of that process. So there's no biologically plausible mechanism how this will alter your DNA or alter your offspring. That just can't happen. That would be science fiction. If we could do that, we would cure all other kinds of disease using it, and we can't do that.
And one of the reasons they've made it so quickly is because there's been so many people with COVID-19 disease. So
that's allowed us to do the trials really quickly.
Yeah.
But how we managed to, I say we, I'm not taking credit for this, how it was done so quickly on the shelf, taking it off the shelf, was that the RNA vaccine carrier is a little ball of fat, and it's called a lipid nanoparticle. But the technology to make these lipid nanoparticles has been around for about 10 years and has been used to make other vaccines, vaccines for Zika, chikungunya, attempting vaccinations for tuberculosis. So the carrier is actually very well understood, and the carrier was sitting on the shelf ready to use. So that literally had to be picked up, and then into it put the code for the protein. And that took the Moderna company 42 daid from start to finish. They were actually really proud. They took the genetic code off a database from China, essentially print the genetic code themselves, stick it into the lipid particle, and within 42 days they were ready to start experimenting. And that's
phenomenal.
It's unbelievably, it's just incredibly fast.
Yeah. Well, I'll certainly be in the queue when I'm allowed to queue. Obviously, there'll be prioritization, and we're hoping that people with cystic fibrosis will be high up on that list of prioritization, and we would strongly recommend all people with cystic fibrosis, and obviously there would be the adult patients first, but then the children who are prioritized. It might be that they are prioritized to the Oxford vaccine, and just to clarify, that does have some virus in it, but it's a virus. it's like a virus shell, isn't it? To again get the RNA material into the cell.
So the Oxford vaccine uses what's called non-replicative carrier, and it's the husk or the shell of a virus, but it does not contain inside it the code set for making another virus. It only contains the code set for making the protein for the immune system, and that's essentially the email. So it's a different way of sending the email to the immune system. But it does use the shell of a virus-like particle, but it is not a live virus.
And although these vaccines have not been tested directly on people with cystic fibrosis, there's absolutely no reason to feel that people with cystic fibrosis won't mount an immune response as a result of having these vaccinations, because people with CF have very good immune systems. It's not their immune system is not part of the underlying problem of having cystic fibrosis. And is there anything else to add before we leave you to your next important meeting?
No, I think that we need to realize how much hard work the health service has done in trying to look after people with conditions other than COVID. And COVID's been all that's been talked about. But from where I'm sitting, I'm noticing that throughout the outbreak, other services were maintained, and I would be keen for people to re-engage as best they can and make sure that they're not holding back. The NHS is absolutely open, and certainly for cystic fibrosis care, cancer care, asthma care, we're very keen to get back up to full speed and not have anyone holding back for fear that they might be troubling us.
Well, it's certainly been in the CF world. CF teams have done an amazing job to be able to maintain their services, and we're working in very different ways now. But I still think that this is a major step for people with CF. The availability of these vaccines, and we would strongly recommend that as soon as people with CF have the opportunity to access these vaccines, that they should do that.